Hello, I'm Dr. Orly Avitzur, President of the American Academy of Neurology, and today I'm launching a new AAN video series featuring neurologists and their patients discussing the value of connection, neurologic care, and brain health. Let me welcome Dr. Natalia Roast and Jessica Diaz today, who are going to tell us how they met. Jessica, would you start by telling us what happened to you?
Yes. Thank you so much for having me on. I'm, thrilled to share about my wonderful experience I've had with Dr. Roast. I met her 9 years ago when I suffered a stroke at the age of 36. Fortunate for me, I live pretty close to Mass General Hospital, where I received amazing care for a stroke. When I went into the hospital, I had no idea I was having a stroke. I didn't even know at age 36 it was something I would ever need to worry about. I thought maybe I was just having a severe migraine. So I was pretty shocked when I was admitted. I had a shooting pain down the left side of my body. At the point that I was admitted, I could barely move my left leg on its own. It felt more just like pins and needles, and I was suffering from a very severe headache. So when I went into the emergency room, they immediately took me in. I went into an MRI where they discovered that I had suffered a stroke. I was officially admitted to the hospital, and the very next morning is when I met Dr. Roast for the first time.
Thank you. And Dr. Roast, what do you recall about your first meeting and subsequent care of Jessica?
I remember a young mom, mother of 2 children, scared in her bed and her eyes filled with tears. I immediately connected to Jessica, and I remember that the first thing that, I had to tell her that she's going to be okay. We already obviously had an advantage of knowing what happened to her overnight, given the technology that's available to us through brain scans. And we knew that Jessica is going to have a road ahead of her, a long road ahead of her, figuring out what caused her stroke, how can she prevent a stroke from ever happening to her again, and how is she going to rebuild her confidence and her life ahead of her, taking care of her kids and having her very busy career as a fitness instructor. And that was the one of the quintessential kind of cases, the stroke cases that we see. But Jessica's story became so much more than just another case of stroke.
And Jessica, how long did it take you to improve?
Fortunately for me, within a day or so, I was actually physically able to move my left leg again. So I know I was very fortunate to physically recover that quickly. I would say for me, probably the emotional part of the stroke has been the most difficult. Just shock of experiencing a health event that serious and the fear of it happening again.
And Dr. Roast, what kind of advice did you give to Jessica, and do you give to stroke patients in general?
Well, we always talk about the neurological disability that comes with stroke, but really it's also the trauma, the acute trauma that somebody like Jessica, who is at the prime of their life, leading a very busy life, and suddenly everything stops to a screeching halt. And I think the most important advice that I always give to a patient is to try to turn your tragedy into your strength. And I think one of the most important ways you've done that is through connecting with other stroke survivors and educating your friends and your family and your community with regard to signs and symptoms of stroke, and being aware and having the knowledge, which is the power in this case.
Anything else you'd like to share, Jessica, about your relationship with Dr. Roast and how it sounds like it was instrumental in healing and in getting you to the point you're at today?
I think what Dr. Roast just said was the biggest part of my physical and mental recovery, was looking for the silver linings. As unfun as having a stroke is, I don't know if I would take it back. I definitely have learned so much about health, wellness, but also about perspective on life and looking for silver linings and, kind of becoming a person that tries to, help other people. I don't think I was so much that person before my stroke. So.
Thank you for bringing such awareness to stroke and the importance of getting immediate attention to symptoms of a stroke.